working in the domain of consumer protection policies, not only in India but overseas for last 40 years. I always speak on behalf of the patients or on your behalf as the consumer. So that has been my domain expertise, which I am trying to fulfill. So I'll then request Dr. Upadhyay. 1 minute. सबके पास mic है.
Myself, Dr. Kaustubha Upadhyay, advisor in Ministry of Ayush. I am looking after drug policy section and National Ayush Mission technical part and all the schemes. As well as I was recently, till last month, I was looking after quality control section also regarding laboratory and L&P section. And now, as a part of drug policy section, I am also looking after insurance, both public and private. And Bejanji is the chair of our insurance core committee, and many of us are members of that committee also. That's one of the reasons why we are all here also. So I am looking after both insurance as well as government infrastructure part.
Thank you, sir. Namaskar, all the participants. I am Dr. Raghu Arakal. A means Arakal. I am working as a Deputy Director General in the Directorate of Health Services. Ministry of Ayush has created a Ayush vertical in the Directorate of Health Services in the Ministry of Health and Family Welfare. So that itself shows that what is the future directions for the integrated healthcare in the country. And currently I am looking after all the Ayush related public health programs, even the national Ayush missions, public health initiatives, even the insurance sector also I am supporting with the Ministry of Ayush in that national committee, and even the PMJY component of insurance sector, that aspect. And similarly, even the standard treatment guidelines, that is one of the standalone initiative that we are working with the DGHS. Thank you.
Thanks so much, Dr. Raghu, right? I work on health economics and market access, and mostly on financial access to healthcare. Work both on health insurance and healthcare financing, and been a part of health policy for a very long time, and health insurance policy also for a long time. So I'm really glad to be here to talk about the new approaches to healthcare delivery using insurance. And I'm a firm believer of integrative healthcare. Thanks.
It's wonderful. It is wonderful to be here today with it's on. Yeah. So it's wonderful to be here today. Third time around, it's wonderful to be here. And the fact that we have such an illustrious set of speakers with such wide-ranging experience. Quickly, my name is Rajiv Vasudevan. I'm the founder and managing director of Ayurveda Hospitals, which is now Apollo Ayurveda Hospitals, a chain of precision Ayurveda inpatient care hospitals, insurance approved, and we have focused on protocols-based, documentation-driven, very robust medical care for the common Indian, across all segments, and we spread across Cochin, Bangalore, Chennai, Gurgaon, Delhi, Almora, and soon in Hyderabad. Thank you.
Good evening all. I'm Dr. Srival's Menon. I represent here as a managing trustee of Global Homeopathy Foundation, an NGO operating predominantly in India. We have members about in 10 countries, and we have another country chapter in Australia. And we actually engage with a lot of policy, regulatory, and recommendation. And we actually try to help the fraternity in all levels, three-dimensionally. And this particular topic is one of the areas which has enthused us the most. And apart from that, I Actually, I'm a clinician. I run a couple of chain of clinics. Probably the first to start multi-specialty clinics in homeopathy about 20 years back. We have 2 brands. We run that too. Thank you.
Now that you know who these funny looking guys are, you know why I made this introduction is that you get a bit of a background in terms of what they are, what they do, where they come from. So the next point, of course, would be that as the chair of the session, I will ask questions to them and they would answer. They've come well prepared, let me tell you. They've come well prepared. But what I want to tell you is I'm not going to give them much time to speak. I'm going to give a lot of time to you people to speak. Because I would like to hear from you all in terms of what they open. So I'll start with one of the government person who is next to me, who is the advisor and very, very focused person. You all, many of you know him. You know, Dr. Upadhyay comes from Karnataka, forcefully now staying in Noida, Delhi, you know, and he's enjoying himself. So my question to you is, you got a vertical called insurance with you. Can you explain what this animal is and what this government plans to do under Ayush to move forward in the coverage? Because India is the lowest in the world in insurance coverage, let me tell you. So we have a huge scope. You know, not even 4% is covered. So what you need to understand is, so many people need to be covered in our country. So how you will take a role under the Ministry of Ayush to trigger the growth of health insurance for the Ayush patients? Dr. Upadhyay.
See, for having good health coverage, one is government infrastructure. We have primary, secondary and tertiary health facilities across the country. But we have 140 million population, 1.4 billion population, which we cannot cater in the government setup for all this population. So we should have a facility in private sector also. There is a facility, but whether they are affordable and whether they are accessible to all, that's the issue. So insurance, so for government, we used to have insurance facility only for its employees in the beginning. We had CGHS, ESI and all these things. So for our employees, even public sector companies, many public sector companies had having their own facility for serving their employees in any health needs. But larger population, if they cannot access government services, you can know what is the line of patients in the All India Institute of Medical Science just nearby. So much of population, how we have to cater? For that, we should have public health insurance also. This Ayushman Bharat, this insurance scheme, ABPMJY, that is one of the facility where for those who having no enough capacity to afford for insurance coverage, government is providing coverage up to 5 lakhs for getting the treatment. So far we have only allopathy or conventional system accommodated in this. But there are many diseases which cannot be catered by conventional system. For example, osteoarthritis. Almost all of the whole of the population are going to get this problem, whether they want or not, because of the age. After 45, women are likely to have, and men folk after 60. But whether we can get the relief from the conventional system, whether is it possible, may not be. So we should have an opportunity. We should provide an opportunity. Government policy is a consumer, as a people, public should have a choice to get the choice of treatment where they believe that they can get the benefits. Why people come to alternative, this Ayurveda or homeopathy or anything, when they cannot get the relief in the conventional system where they are used to go every day? Then only they will see what is the alternative. So for example, why now Ayush is, this program is arranged today? If it was not been 2020 catastrophe, I don't think we would have not sit here to discuss all these things, especially during first wave of COVID. We all imagine how this COVID has brought the focus to the Ayush, because we had no answer at all in the conventional system, what to do. Entire world, but we had started taking, everybody started taking, somebody haldi ka dudh liya, somebody haldi ka khada, something like that. So many things started. Somebody told your rasam is a very good medicine against corona. So everybody preparing rasam. So this thing happened, and this really helped also. During the COVID era, almost 99% of the population have used one or the other Ayush medicines, and many of them, around 80% of them, truly believe, it is a output of the survey, and truly believe that they have got the help from the Ayush systems. So this shows what is important. Second, for example, we should have a facility for all the public, whole population. We have 140 million population. If we depend only on convention, we have around 8 lakh Ayush doctors who have conversed with both their traditional system as well as modern. Whether government should not use their benefit for the whole population, that is the policy. So now we want to provide health facility of any system of public choice. So it is both in the government insurance as well as private insurance. Regarding private insurance, 2016 IRDA come out with the guideline values and definition of hospitals, everything. But how much of hospitals have been empaneled? How many consumers, insurance policy holders are getting benefit of insurance? That is very bare minimum. So we decided it's an important aspect. Even private sector should encourage this penetration of Ayush as a policy. So we had discussed in one meeting, and then we decided to form a core committee. And now a lot of progress. We have an interaction with the insurance companies and all other stakeholders. And now IRDA has come out with the policy that by next April there should not be differentiation between conventional system vis-a-vis other Ayush systems. So everybody should give a choice for the public, whether you choose allopathy, Ayurveda, anything, you should have a choice. And for that, already there is a mandate for all insurance companies, and work is going on. They are also actively participating in designing the products and revising their existing products to accommodate Ayush. Thank you.
Well timed. चाय उठाने वाले थे कि खत्म कर दिया. Very good, very good, very nicely said. You know, the bottom line is, you will be amazed to know that 1st April नहीं आया है, but उसके पहले से इतने awareness बढ़ गया है कि now every patient who are going through Ayush treatment have already started talking to the insurance companies in terms of हमको include कीजिए. They've already started talking, let me tell you. And the data is showing there is a body called Indian Insurance IAB, Insurance Bureau of India, you know, which is part of the IRDA, the regulator, which is based out of Hyderabad. And they were not collating the data of Ayush. They used to say, hey, the significant, क्या होगा, कितने लोग मानते होंगे and all that. You will be amazed to know that there were only around less than 2,500 claims throughout the year. In private insurance, I'm only talking about, which has gone up to 11,000 now. In the last 2-3 years only. The outflow, the claim was only about 3 crores. Huh?
30.
Now it has gone up.
110.
Yeah. So my contention, what I'm trying to say is that from 30 crores to 110 crores, you know, in terms, no, I'm talking about the claim disbursements. No, claim value. The claim disbursements, yeah. So what I'm trying to say is that it's gone up 4 to 5 times more now. In the last 3-4 years. 3-4 years. But what is very interesting is now that from 1st of April, आने के पहले से, the insurance companies are coming and telling me that sir, जो 1 लाख का क्लेम होता था पहले वो 4 लाख हो गया क्योंकि वो इंक्लूड हो गया आयुष. The hospitals have charging. Now what I want to signal before I go to Dr. Raghu is that costing has to be very realistic. It cannot be falsified. It cannot be manipulated. And in the morning I recall very vividly, as usual, my mentor, Mr. Rajiv Vasudev, I can't move without asking him. कहीं गलती से कोई गड्ढे में हम ना गिर जाए तो हम इसलिए उसको पूछते रहते हैं कि इस रास्ते में कहाँ गड्ढा है बताइए हमको. So what I want to tell you all is that you see, at the end of the day we all have to understand that how do we do this costing, how do we make sure we move forward in a manner. And he mentioned in the morning, as I was going to tell you, that the demand and supply. As a consumer person, you see, I come from the consumer background, and my work has always been, because I joined this movement in 1983 when there were big monopolies in the country. You had to wait for 10 years for a telephone connection. You had to wait for 12 years for a Vespa scooter, Bajaj scooter. आई डोंट नो कितने लोग इस रूम में हैं जो सब एक्सपीरियंस किए हैं. अभी तो घर पे आके बोलता है फोन ले लो, पैसा के बारे में बात मत करो, फोन ले लो प्लीज, दैट काइंड ऑफ अ थिंग. नो, द होल टेबल हैज टर्न्ड. यू सी, द इशू व्हाट आई एम ट्राइंग टू से इज द बेस्ट फ्रेंड ऑफ द कंज्यूमर इज कंपटीशन. प्लीज रिमेंबर दिस. एंड द बेस्ट फ्रेंड ऑफ द कंज्यूमर इज empowering the consumer to make a choice. But an informed choice, a credible choice. Not Amitabh Bachchan selling the product. You see, choice based on credible people like Mr. Dangayach talking about it in public domain. Or Mr. Rajiv Vasudevan talking about it in public domain. People who are credible, who have been recognized. The community must know them. So we have to move towards that. So in order to move towards that, we always look at government again. So Dr. Raghu will tell us that now that he is sitting in the Ministry of Health, under DGHS, आपका पॉकेट में क्या क्या है जरा सा हम लोग को बताएंगे. नहीं, because we as consumers always believe खुलासा होना चाहिए. Transparency and accountability is our key. Is our key. If you are transparent, you are my best friend. So Dr. Raghu.
Yeah, thank you. As I mentioned earlier that when we thought about that the future direction of the integration of Ayush systems into the healthcare system, the conventional healthcare system, first of all, we thought that how this is possible in the context where the primary healthcare setup in the country and the secondary healthcare setup and even tertiary healthcare setup have that kind of uneven distribution of the infrastructure, the quality of the human resources, even the medicines and the entire gamut of services which is required for that kind of system is uneven. But then we thought that there is a need which is actually the demand actually generated from the public huge hue and cry, and that has to be reciprocated by the government. And based on that, we thought that there is a huge scope for, particularly in the previous session also mentioned, non-communicable diseases, and huge energy is there for the entire Ayush sector. So this can be appropriately utilized, appropriately assimilated into the entire healthcare system by sitting along with the mainstream healthcare in the country. So based on that, even simultaneously our national health programs, which actually incorporated into the National Ayush Mission, very specific 8 public health programs have been introduced under that. The musculoskeletal disorders, geriatric care, because geriatric care, we often says that there is a need of very focused attention to this population. However, whatever the strategy so far adopted is yet to give its result. So, because the basic reason is that we have not inculcated the strength of the traditional system into that. So, based on that, we thought that this Vayomitra, that's a component that we have introduced in the National Public Health Program and the National Ayush Mission, which is also now it is rolled out in the states. Similarly, another neglected disease, often we call it as a neglected disease, lymphatic filariasis. There is a huge scope for Ayush systems to have an integrated mode, and we have introduced that in the states of particularly this northern Bihar, Jharkhand, where there is a considerable population is there actually, that the incident rate already have been significant impact in the community. There also this is Ayush specific interventions we are doing. And moreover, for all these integrated efforts, there is a need of standard treatment guidelines. Many of our research councils have attempted the standard treatment guidelines to bring into forth in the public health domain. For large number of practitioners who are in the field, there is a need of reorienting them to the strength of the Ayush and actually how they will work in a primary healthcare sector, in a secondary healthcare sector, and at what stage they will make appropriate reference to the other systems of medicines. Because until and unless we have carved out that kind of guidelines, it would be difficult to exactly technically administer these type of healthcare facilities. And you might have aware about that recently our ministry has also published Indian public health standards for Ayush systems. Earlier these standards were exclusively available for the conventional system, and it was mentioned that at that time itself that whatever the standards required for the Ayush will be made by the Ministry of Ayush. Accordingly, it was thought that it is our responsibility to have that kind of standards in terms of infrastructure, in terms of quality of care, in terms of medicines, and in terms of clinical governance. So based on these actually Ministry of Ayush now published 2 documents of Indian public health standards for Ayushman Arogya Mandir, that is erstwhile it was known as Ayush Health and Wellness Center. So now it is Ayushman Arogya Mandir. Another one is for the Ayush Hospital. So in that very specifically it is mentioned that there is a population, because so far we have not thought about whether, if you want, in the initial statement itself mentioned universal healthcare. So even though the spread of Ayush physicians may be there in the even the remotest area of we have the Ayush doctor, but in spite of that, appropriate resources, appropriate healthcare facilities, whether it is available in this remote area, we have not made any mapping till date. But this IPHS, the formulation of this IPHS, we have asked all the states and UTs to map their facilities to suggest us what is the existing facilities available in the rural and remote and even the urban area, and what is the gap area. Based on that, we have now made the IPHS standards, and based on that, it is desired that for 10,000 population, at least an Ayushman Arogya Mandir is required, whereas for 5,000 population, it is a desirable target. There we mentioned even the private sector can also rope into that in making this realization to come into a fruitful direction. Similarly, even for the Ayush hospitals also, we have made the specific geographical coverage for Ayush hospitals also. For example, for 50,000 population, at least 10 minimum beds are required. Why we have calculated this at least 10 beds of minimum beds are required? Because considering the current patient footfall of the Ayush systems of medicine, current inpatient healthcare offered by, mainly we have depended upon the public health facilities which are on particularly the teaching hospitals and other things. In addition to that, we also scanned many of the private institutions who are offering the healthcare in a standalone mode or even in integrated healthcare mode. So based on that, we have arrived at data. So I think these efforts of the government will be clearly give a direction to the development of the Ayush sector, particularly in the private, in the primary, secondary and tertiary healthcare.
Very good. Thank you very much. Thank you very much. Before I go to Dr. Rajiv Vasudevan, Dr. Upadhyay wants to intervene and add something on. But I want to tell you something. जितना कुछ आप बोले हो ना, somebody is recording and also going to listen to it very carefully. And so what I'm trying to tell you all is, you know, when you go back to Telangana, please make sure what he is saying, you can see it on the ground. You know, and that is our job. That is our job. So very good, lovely initiatives you are taking up. And I'm sure, you know, this is where the youngsters needs to be pulled in. You know, people who are coming out of the college, they don't know how to make a career out of Ayush. Where to go, what to do. You know, I remember when you all invited me to Chennai, you know, the youngster who came to receive me at the airport, I asked him that what do you want to do, you know, tomorrow, what is your... So he was giving his roadmap, you know, in terms of his career path. Now this is where we need to work, you know, with these youngsters, to get them to this, you know, Arogya Mandir and to be hands-on on the ground, and they get a career out of it. You know how we can do that? Because you can imagine for every 10,000 there's going to be one, and government is definitely going to, you know, use your and my money to do that. So why not we make sure that it is done well and in an efficient manner? Yes, Dr. Upadhyay.
I want to share certain data. In last 1 year, under National Ayush Mission, we had a 40 crore footfall of the patients in our Ayush facilities alone. This is one of the information. It's not a very small number, it's a very big number. Second,
Sir, sorry, is it government data?
it's a data after proper survey, third party survey and compilation of the reports. Second,
जो सेक्रेटरी ने सुबह को अनाउंस नहीं किया, वो छुपाया है।
ये नहीं सेक्रेटरी साहब इसको बहुत जगह बताते हैं, आज बताया नहीं होगा क्योंकि रघु जी ने ये इश्यू राइज किया. I thought it's better to, it is official.
Very good.
It's official data only.
Very nice.
Second, for the first time, we have made NABH certification compulsory, or we initiated NABH certification facility for Ayushman Arogya Mandir.
Wow. Very
And
good. Very
as a first stage, we had targeted 2,000 Ayushman Bharat Mandir to be covered under NABH certification, and this has made a grassroots level changes. Earlier, many times it was having been in papers, and many times there may not be anything. Now, after this, every state government is keeping keen whether the facilities are intact and it is in functional status, and all this attention has been given in the grassroots level. This is a biggest change because of this certification, and we are also having around 50 or 150 bedded hospitals. We are giving certification under National Ayush Mission. So quality aspects also will be taken care of, and government is keen, and mandate of the Honorable Prime Minister is that Ayush has to come out with the evidence and science. We are not coming just to be traditional, that concept we have not keeping. Now we will come out with parallelly with sufficient evidence and full quality, and we can assure the population that we will deliver the quality services. That's the concept of the government sector.
Excellent.
I need some clarification on this data. 40 crore footfalls you said, and the total coverage is also 40 crore. That means everybody visited.
Some people may have
No. 40 crores, which you are saying is Ayush coverage, but it's not that.
It's
what
the
he's
total
saying,
number of
it's a total-
patients.
whether it's covered or not covered, people who have visited is 40 crores.
Ayush facilities in the government sector.
So, yeah,
Footfalls.
out-
Total number of footfalls.
So out of 1.4
It's not
billion
insurance
people,
coverage.
out of 1.4 billion people in the country, 40 crores visited Ayush.
25%.
Correct. So which is a great number. You know, it's too much.
It's a great number. At the same time, it speaks of the sickness in the society.
No, for Ayush,
Not sickness.
people not only come for sickness, they come for health promotion
Yeah.
as well as
What
health protection
you
and
want?
lifestyle changes.
See,
Advice.
what you need to appreciate is, and this is where we come from. I mean, we मतलब हमारे जो cluster है जहाँ पर हम काम करते हैं, is awareness is always the most important thing, and that is why the footfalls have increased, because the awareness has gone up, not because people are unhealthy. They have become healthier because they are concerned about their health and they want to go and visit. So awareness has gone up. You know.
One more thing, this doesn't include.
Yeah, absolutely. So let's now listen to my mentor, Rajiv ji. Rajiv ji, everybody says, अरे जहाँ जाओ वहाँ राजीव जी पहुँच जाता है, सब जगह में राजीव जी है. तो हम ये कहना चाह रहे हैं राजीव जी से, आप इतना मेहनत कर रहे हो, आयुर्वेद को ले जाने के लिए आगे. I mean, phenomenal. And you showed me also some of the institutions where you are involved. I visited those places in Bangalore, Delhi, Chennai, all kinds of places, Bombay. I have already visited so many. I mean, latest was Jamnagar, not for the party. To go to that university where, our secretary was chancellor, vice chancellor. So what I am trying to tell you all is that at the end of the day, we are all very keen to know from you, how do you think Ayurveda can play a role in terms of achieving universal health coverage?
Thank you, sir. It's been most humbling that a person of your wisdom, and we're very fortunate in the Ayush sector, let me tell you, on all our behalves, that Professor Bijon a few months back, got involved and not only has very ably and wisely steered the workings of the committee, but he's also brought in a lot of other very good people into this movement, which is to mainstream Ayurveda. So we're grateful to you.
Thank you.
Similarly, I think the kind of very focused discussions you see now, if you go back a few years, my colleagues from the Ayush sector will tell you that to have an advisor and to have a deputy director of DDGHS to speak with the ownership and confidence. We heard the secretary today morning, but each point with clarity and data, right? So we are fortunate, truly, I'm not flattering you, to have you driving what you're driving today. And the insurance sector focus has come with all of this. So to cut to my topic now, when you look at universal health coverage, the data I just shared with you, I just took it from the net, 324 million Ayushman Bharat cards issued. In the last 5 years, there are 2 points of data, one from PIB, which is the official source of the government, one is from a newspaper article. One says 54.7 million people accessed, another says 29.5 million accessed. So there are 2 varying points. But if you take an average, that comes to 6 million people a year to 10 million people a year, right? As compared to that, if 40 crore is the number that we are seeing here, there is something stupendous happening. Of course, this is tertiary care, this is primary care, and so on. So everything is coming together, that is it. Before I go into the topic, a very important point that was articulated by the secretary today morning, and then again repeated by DDGH's Dr. Raghu, that I don't know if the significance was lost, which was a treatment protocol for filariasis is the primary protocol of these states. It is not that in an Ayushman center we are using that protocol. This protocol is the protocol of this country, right? So that is the biggest vote of confidence, right? So in terms of integrative medicine, it's a very different spin on the whole subject. It means where you need to do this, you bring Ayush. Where you need to do modern medicine, you bring modern medicine. What is in the best interest of the patient? Really great. When you look at, therefore, the access to care, Professor Bijon in the beginning read out the precise definition, in which one thing we should really note that when people want the kind of care with minimum impact on the purse was something which was told. If this has to happen, how can it? Right? And Dr. Raghu talked about how do I differentiate between primary, secondary, tertiary needs, how do you refer out? So if you look at the fact, in a state like Karnataka today, 1500 health wellness centers which are manned by Ayush doctors. These are the modern medicine health and wellness centers, manned by Ayush doctors. What is the role of a PHC or an HWC today? Essentially is as follows. To tackle day-to-day healthcare conditions, which comes in the local community. They understand the local conditions, they know the families. So apart from the ASHA worker, they're able to see the local needs. And then with that, when the patient comes, they're able to do two things quickly. Does this person come within my scope of care, or should I refer to a higher center? This is something quickly to triage and send out. Number two, if that condition comes within my scope of care, what is the best system to do? Should I give a paracetamol? Should I give a kashaya? Should I give this? So quickly I'm able to triage and give the line of care which is appropriate for that patient at that time. Right? So if I'm able to do that, every village, every place, we'll be able to give accessibility at the first point of care. So the protocol send him to an Ayurveda hospital or to homeopathy or to a Siddha, whichever comes, but or to an allopathy hospital. It doesn't fall into an Ayush scope. So these protocols can be easily developed because I am primarily into symptom management at a HWC. Right? And I have to refer out. So we come with that. So a tiered structure of primary, secondary, tertiary care with clear protocols when to refer to either or this or that will be a very important step. Only then the fact that, and let's keep in mind, 500 million people covered for 5 lakh rupees, huge amount of money. But the fact is most people don't know. As Professor Bijon relentlessly keeps telling, awareness is the key, awareness is the key, people should know. And the point which he mentioned, the choice, the power of choice. Right? He talked about competition and choice. The moment we are opening this up, I believe the consumers will have access with a solution. So I want to tell from a recommendation standpoint, Ayush says a lot of things in terms of the benefits it can give a community. Can we look at a pilot project? Okay, there are enough centers that you know that this is happening. Take a cluster of, first of all, not just a primary HWC, but take primary, secondary, tertiary, and show a model of seamless escalation and demonstrate to the country that Ayush at the heart can really be a model for health for all, every day, at every time. This thing can be done, and we need to show that it can work without competing with any other system. In collaboration, we can do. So rather than compete, let's demonstrate. Thank you very much.
Very good, very good, excellent. So, you see, the first lesson I learned when I went to the business school, I was taught that before you sell a product, you need to use it yourself. और हमको याद है, because I got inducted as the chair of this group for insurance in Ayush in the month of October. तो हम दौड़ कर गए इंश्योरेंस रेगुलेटर के पास और हम बोले ऐसा ऐसा हो गया, हमको ये जिम्मेदारी दे दिया. तो हमारे तरफ देख के बोलता है, तुम कभी आयुष हॉस्पिटल विजिट किया क्या? हम बोले हमको सबसे बड़ा वरी तो यही है, अब हमको जाना पड़ेगा. So you see, the point which I am making is, after I got inducted in October, I must have convinced not less than 300 friends of mine who are ailing out of some chronic disease or non-communicable disease, to tell them, यार आयुष भी ट्राई कर लो ना. तो बोलता है क्यों यार, क्यों ट्राई करेंगे, क्यों हमको पुश कर रहा है इसमें? हम बोले क्योंकि अब चॉइस आ गया है. तुम्हारे इंश्योरेंस कवर है? बोला हाँ है. तुमको 100% रिइंबर्समेंट मिलता है? बोलता नहीं मिलता है. तुमको आयुष में मिलेगा. और रियली मिलेगा? हमारा हाँ मिलेगा. तुम ट्राई तो करो ना, कोशिश तो करो. So the point which I am making is, the selling point becomes, and this is again I learned in my business school because I majored in marketing, that your actual marketing starts when the customer says I don't want. I don't want to buy this product. Then your skill comes. Then वो कूड़ा को भी तुम गोल्ड का भाव में बेच सकते हो, जो हो रहा है आज. through huge publicity and promotion. But I don't want to get into that unethical route. I want to make sure that Ayush gets into the ethical route. And not only promises but guarantees that I will not compromise on quality, safety and efficacy of this product, and I will give the best outcome to you. Having said that, I would now get you to listen to Manish ji. He's a he's the trigger, the engine for policies. He's worked in the insurance sector. He's advising insurance companies, and he's into a lot of policy activity. He's got his own organization. He's independent. He's on his own now. So Manish ji, we all want to hear from you. How do you think now, would be the next step which we should take to bring Ayush in the forefront? And all the people who are insured, well and good, who are not insured, they'll say, I'll take insurance because I want Ayush. I want to go to Ayush. I want insurance. And is there a product for only Ayush? And can that product be bought at a much cheaper cost than what I am paying today for health coverage? So how do we innovate into that, Manish ji?
A lot of questions in one. So I'll start with Ayush made an entry into health insurance, private health insurance, way back in 2012 when the first regulations were drafted for health insurance. We made an entry for Ayush to be reimbursed at that point in time. In 2019-20, we emphasized that everybody should be mentioning it in their policy, and there should be a requirement wherein the policy should state clearly as to what extent the insurance company would be paying for Ayush treatments. And now I'm glad this has happened, that from April 1st, 2024, it is going to be considered as a total sum insured is applicable for Ayush. So it's a great leap forward as we look at health insurance and adoption of Ayush. A couple of things which have been which really have been pointed out by Professor Bijon Mishra also is that hardly any claims were coming in the first few years. It's I would say ever since 2018-19, I think after which when Rajiv and CII started to work together, we got some more traction in terms of how we need to look at pricing, how we need to look at reimbursement processes and structures. And then I'm very glad to see that today, when we're looking at the IIB data, it's 110 crores. Now, when I'm looking at 110 crores vis-a-vis the 60,000 crores of allopathic treatment, there's a huge way to catch up for Ayush, and a long journey to be caught up. The component which is very important, what I feel is there has to be complementary treatments which are happening, and as the word says, integrative treatments have to be looked at. Initially, I'll tell you, in 2008, there was a Stanford Biodesign project with AIMS, IIT, and Stanford, and a couple of companies sponsoring it. It came out very clearly for breast cancer treatment, post-chemotherapy, post-surgery. It was Ayush medicines which were prescribed even at AIMS and other places, and saw fantastic results. So the chemo cycles the person could take increased, and the outcomes became better and better. So you see, there's a adoption, and COVID became one of the triggers for Ayush adoption. So if I were to look at Ayush becoming a mainstream in times to come, I think one of the important components is standardization to a larger extent. As Dr. Raghu pointed out, standard treatment guidelines are very important. Standard way of addressing, and what's more important is standard treatment guidelines along with the I would say integrative medicine. How you would be combining that? That's a huge task. how are you going to take the allopathic medicine into the fore of the Ayurvedic Ayush treatment protocols? And if we are able to do it, if the right research, right structures are possible, then possibly we may be catering to the world for treatments all across and all the disease profiles. So, for Ayush to get adopted, I think a couple of important components. A, standardization. Standardization is two components. A is standardization of treatment, assessment. Third is medicines. I think the huge disparity is there in terms of quality of medicines and quality of ingredients which are going into medicines. I think that is one of the very important focus areas we need to look at in terms of how we are able to regulate, how we are able to innovate. And to me, one key driver which is going to be very important is that the regulator is progressive. A progressive regulator will drive. Why should only a plant-based be used? Why can't a derivative be used? Why can't a substrate be used of the right potency to provide the right medicine? We know for certain that if a crop is grown in various seasons, the potency, the chemical composition of the crop varies. So the medicine quality also varies. Now, can we look at standardizations? Can we look at innovation happening in this so that our medicines are equally potent? So one is standardization of medicines, protocols, guidelines, and integration of allopathy and the Ayush treatments, whether it is homeopathy to be propagated or suggested, or it is the naturopathy to be suggested, or the Ayurvedic to be suggested, where and how. I think those decision support systems have to be created, and that's a big job which the government and the sector has.
And thank you very much. And the way and 1 minute, you know, बेचारा गोपीनाथ वो हमको चबा लेगा एकदम, अच्छा चबाएगा। आप उसको थोड़ा सा मौका दे दीजिए, उसके बाद हम लोग वार्तालाप करते रहेंगे, you know, जितना देर आप चाहो, क्योंकि हमको तो यहीं रहना है आज रात। So what I want to tell you all is that because I know you have to go back to your wife. I'm going tomorrow. So the most important issue is, again, you know, because being from the marketing side, I always look at the customer as the king, you know, and I always feel that यार जो जिसके बदौलत हम कमा रहे हैं उसको हम सुन नहीं रहे हैं, उसको हम देख नहीं रहे हैं, तो हम कैसे फेयर हैं? I am not fair. So create champions also within the community who are promoting Ayush and recognize them time to time in events like this. Bring them on the forefront. Give them that recognition so that more and more people get into this business of championing the cause of Ayush, not only in India but globally. It's very important because I am a firm believer. जोर से करो। ये bigger script का हम बोल रहे हैं, very impromptu from the heart. So you like to have a dividend, which is a clap. So the area is too good. You know, I must tell you all that you know this story. आप लोग जानते होंगे इस mundane story. You know, एक बंदा एकदम लास्ट तक बैठा हुआ था, अकेला सुन रहा था वो प्रचारक को, you know. तो पूछा, यार तुम क्या है यार, तुम तो हमारा रियल शागिर्द है, तुम बैठे हो इतने देर तक? बोले नहीं, हम बैठे नहीं, आपके लिए हमको कारपेट लेके जाना है। So what I want to tell you is that वाकई में जितने लोग आज यहाँ बैठे हैं, I must salute you guys because it's really very encouraging to see these smiling faces at this time of the day, you know, and it's very, very encouraging. Gopinath, Prepared? Because I have to ask the last question to you. Gopinath is known to be international and global. जब भी उसको फोन करो दुबई में है। हाँ, हमको पता लगाना पड़ेगा कि दुबई को भाग रहा हो so often. So आज यार हम लोग को you have to tell us why do you go so often to Dubai, and you have to tell us that what are you doing in terms of creating that traction on homeopathy, and how do you think homeopathy can play a role in universal health coverage? Gopi.
Yeah, thank you. I'm so happy he's calling me my dad's name. It just passed away. But, basically by Shrivals Gopinath Menon. Firstly, I should not miss to mention, thanks to CII to give this, unique privilege of, getting homeopathy into, in the discussions of insurance, because I think we are mostly like a toddler in the insurance areas. I don't think not much of scope of insurance has actually been initially been what was visible, which has been there until now. So I think this task of trying to give an idea about what is the impact which insurance homeopathy can make into insurance in Ayush insurance or in general. So I think that's something wonderful, which I would like to address. So I taken some input from, I think I was talking to Bijan sir earlier also, some inputs from Dubai where I keep visiting often. So it was very interesting to see Dubai to the whole of TCAN. They call it TCAN, not Ayush. They were extending insurance for about more than 12 years now, if I'm right. Where the latest packages which tells us is they give an OP insurance, which includes OP for TCAN, which it's pretty much like Ayush, which is about 5,000 dirhams per year, and which is reasonably good considering consultation starts at 150 dirhams to 500, very rarely up to 1,000. So I think this takes care of relatively a good share of the damage which actually otherwise would be happening from the patients. Now coming to the core points of like what difference can homeopathy make by being present side by side with other rest of Ayush, and what difference can it make? Yeah, I think the numbers of homeopaths are actually the first thing that I want to share. It's about 3.12 lakhs, which is about a little, almost half the world's homeopaths, or maybe a little less than that. So this is the number which actually we have, and the kind of involvement of homeopathy into OPIP healthcare or insurance policies can actually go to the grassroots level, trying to make the insurance companies really happy by getting this the greater coverage net, if I'm right. That is one. We were talking a little earlier about the advantages which homeopathy can do, probably as a merit towards the insurance side. Probably what many believe. So people who have spoken to, either fans of homeopathy or even who have been observants of homeopathy, they used to always say that the outflow can be seriously reduced because of the kind of the healthcare, the personalized, temperament-based, constitutional-based, all this kind of medicines which can actually make a huge impact with homeopathy. The inclusion can engage a safe economic solution for which homeopathy stands for, and it is known for power. We have very good examples of very deep public health initiative adaptations, like in Kerala, what we have about 2,000 plus government dispensaries, about 50 taluk hospitals, and the stretch of homeopathy which can actually be achieved from a state which actually has a determination in trying to take homeopathy forward. And there are many other states as well which are on the same for the initiative, and with funded other projects like which are very successful models like Janani and many others, which has sometimes some of them having a waiting time, an infertility clinic having a waiting time of 6 months, was made possible by the state, which is actually tremendous. The strength areas of the clinical strength areas being pediatrics, autoimmune, antenatal, NCDs largely, primary care, behavioral diseases, and a broad coverage of viral diseases can actually be very, very interesting for, for public to actually, get to use this. Health security, which always, our patron, the guides keep telling, homeopathy should be projected in terms of health security, and the drug safety part should be highlighted. So this is also one of the major attractions, and this actually would definitely, be a good point for many takers of who wanted to get covered. A huge capacity of integrable models, which homeopathy can cater to, being something very remarkable, because I'm sure at least those who know German football team who actually was being treated with modern medicine plus homeopathy. That's homeopathy with an integral role. A South African doctor, he happens to be quite known to me, has made it clear, the kind of the ecosystem they have actually created in combining an integral models. I am sure a lot of activities happening in India also, but just to take some very fair example. Being a very regulatable entity, homeopathy has been a part of NAB, which could be evaluated by NABH, assessed by NABH. I'm indeed a part of NABH. I've been on the technical committee and also as a principal assessor for a very long time. Mentored by the person sitting next to me from the first sessions of training itself. AMR solutions, I think somebody here, I think the guide sir and many others have actually mentioned. We stand tall, like even the views of Abdul Ghaffur, the lone crusader for, not lone anymore, many have joined him. For a long time he was a lone crusader. He has made a remarkable impact in that, and he vouches for the role of homeopathy in AMR, with connecting to calendula, echinacea and many more. And interestingly, a couple of doctors, I think a team from ICR led by Anup, Anup was one of my close friends, and also on NABH, they've listed out about 98 diseases which can be clearly IP based and also based, but which can be a very impactful insurance, which can carry an insurance interest in that level. I guess I come to the close. Thank you. Thank you, sir.
Very good. Lovely. He has answered the questions which you all wanted to ask? Or you still have got questions? Yeah, please.
Yeah, my name is Narendra Jana. Mr. Jain mentioned that from 1st April, the Ayush treatment will be covered for the full insured amount. So will that be applicable for the running policies or only for new policies?
Running policies. Running policies, all policies. And in fact, I wanted to add one.
I don't think it's written in the policy.
No. 1 minute. अब 2 मिनट बैठ जाइए. अब क्वेश्चन क्योंकि आप कंफर्ट हो जाएंगे तो आई विल बी कंफर्टेबल. You see that circular given by IRDAI says very clearly that every healthcare policy henceforth, every means existing as well as new. New में तो mention हो क्या आएगा? जो existing है, it is deemed to be covered. Ayush. So there is no argument, no insurance company can say you are not covered, you are excluded.
Right, but they are not mentioning this in the policy.
अरे फर्स्ट आप तो टाइम मशीन में बैठे हैं, हम चले गए बहुत आगे. आप अभी नहीं, आपको सर्कुलर भेज देंगे हम लोग. सो व्हाट आई एम ट्राइंग टू टेल यू इज दैट अभी नहीं बोला है, लेकिन जब आप रिन्यू करोगे तब आएगा. आप जब रिन्यू करोगे 1 अप्रैल के बाद तब आएगा.
अभी जो एडजस्टमेंट रिन्यू हुआ है उसका क्या होगा?
उसका तो बोल तो रहे हैं. You didn't listen to my words.
नहीं, I listened, but they are not mentioning in the policy.
अरे they are not mentioning, but it is what they have said. Yes, please tell them.
The circular says all the existing policies has to be revised, and all the insurance companies are directed to revise the existing policy as per the new direction.
Okay, so
So
they will
it is
send
clearly
a
mentioned
new
in
one.
the
And they have,
and
but they have gone to the extent of saying that if you fail to revise,
Okay.
हाँ नहीं हम लोग को ही बताइए ना. अब खाली इनको बता रहे हो, ये क्या मतलब हुआ? उन्होंने You see, they've gone to the extent of saying that if you fail to revise, it will be deemed that it is there. So nobody can escape. What I'm trying to tell you is that is so comprehensive, that circular which they brought.
थोड़ा झगड़ा करना पड़ेगा.
वो हलचल मच गया है और
झगड़ा करने का जरूरत नहीं है. अभी हार्मनी आ गया है.
हाँ.
सेक्टर में आ गया है.
आप चिंता मत करो.
Even in the doctors community, what was there around 5 years or 10 years back from the conventional doctors, now there are a good number of conventional practitioners who accommodate Ayush and who think there is some merits and that benefit should reach to the public. That concept अभी सभी system में आ गया है in all the across the sectors.
Isha is showing such eyes to me. वो मतलब अब please please we'll have to close on time. हाँ please जल्दी.
सभी को सादर प्रणाम. सर मैं बहुत बेसिक से क्वेश्चन है मेरा.
हाँ.
कि आयुष जो है एक प्रकार से आयुर्वेद जो है नेचर बेस्ड ट्रीटमेंट है, राइट. अभी मैं जो सबसे बड़ा क्वेश्चन देखता हूँ जो रोज मेरे पास समझता है, आयुष में अगर बसंत ऋतु चल रही है अभी और हर पेड़ पौधे में पत्तियां झाड़ रहे हैं नए पत्ते लेने के लिए, इंसानों में भी उसी तरह से छींके आ रही हैं और निकालने के लिए, लेकिन हर कोई एक व्यक्ति प्रोटीन खा लेता है और खा के फिर वो बीमार होता है, हेडेक हो जाता है पूरे साल भर के लिए, फिर वो आयुष में आता है तो उसका भी इलाज है. तो आयुष को एक जो प्रकृति आधारित चिकित्सा है, प्रकृति और जो सिस्टमेटिक डेवलपमेंट गोल सस्टेनेबल डेवलपमेंट गोल है, उसको भी अगर हम प्रकृति आधारित चिकित्सा रखेंगे तभी हम अचीव कर सकते हैं. प्रकृति के अधीन कोई चिकित्सा व्यवस्था सफल नहीं हो सकती.
बिल्कुल सही.
तो अगर हम आयुष को ये जो हम लोग सीधे जब, क्योंकि पेशेंट जो सबसे ज्यादा पहले आता है वो इतनी खा के आता है, दवा खा के आता है. इंडिया में रेमडेसिविर बैन है, सुप्रीम कोर्ट के ऑर्डर से कैसे चल रही है, ये भी बहुत बड़ा क्वेश्चन मार्क है कि जो सुप्रीम कोर्ट जिसको बिल्कुल नहीं नॉलेज है वो कैसे ऑर्डर कर सकता है कि भाई ये रेमडेसिविर अलाउ हो गई है. दिस इज समथिंग रॉन्ग. कि भाई जब ड्रग कंट्रोलर ने बैन कर रखा है तो सुप्रीम कोर्ट होता है अलाउ करने का. पहला क्वेश्चन. तो वहां पर ये देखना होगा आपके माध्यम से कि भाई ये कैसे हो रहा है. जब रेमडेसिविर जो है ये भी मालूम है कार्सिनोजेनिक है, कैंसर पैदा कर रहा है, हम अपने दवाओं से जैसे अपनी औषधियों से आयुर्वेद में बहुत अच्छे से रोक सकते हैं, तो उसको क्यों नहीं प्रायोरिटी दे रहे हैं. तो अगर हमें पब्लिक अवेयरनेस जो आपने बहुत पहले से भी डिस्कशन हुआ, यूनिवर्सल हेल्थ कवरेज, इंश्योरेंस के बारे में भी लोगों को पता ही नहीं है क्या होता है, आयुष में क्या है, आयुर्वेद भी नहीं जानते, ऐसे ऐसे भी हमारी पब्लिक में है. उनको इसको प्रायोरिटी लेवल पे, ग्राउंड लेवल पे जो जानने की जरूरत है वो अवेयरनेस है. उसमें अगर जितने लोग हम बैठे हैं, एक्सपर्ट हैं, इंडस्ट्री के लोग हैं, इंडस्ट्री से ज्यादा सबसे ज्यादा मुझे रोल सर आपका दिख रहा है. आप कैसा अवेयर करेंगे पब्लिक को कि ये छोटे लोग की आयुर्वेद की तरफ टर्न हो.
समझ गया. ये जो क्लासरूम में सबसे ज्यादा बदमाशी करता है उसको मॉनिटर बना दो. So you see, you all must have heard. Raise your hand if you have heard. The Jago Grah Jago campaign. You all have heard this?
Yes.
It started in India in 2005. And I was one of the person who started that campaign. The whole idea of that campaign was that मैगी नूडल बेचने के लिए 1000 करोड़ वो स्पेंड करना था मैगी नूडल बेचने के लिए. कौन? नेस्ले. ब्रांड क्रिएट करने के लिए. तो हम सरकार को बोले कि यदि आप सीरियसली कंज्यूमर अवेयरनेस बिल्ड करना चाहते हो तो आपको साल में एटलीस्ट 100 करोड़ स्पेंड करना होगा उनको अवेयर करने के लिए. आप समझेंगे नहीं? तो सरकार ने हमसे बोला, द टाइम प्लानिंग कमीशन वाज देयर व्हिच इज नाउ कॉल्ड नीति आयोग. वो नीति आयोग के वाइस चेयरमैन हमको कहे कि हम उनको 3 करोड़ देते हैं डिपार्टमेंट को, वो खर्चा नहीं कर पा रहा है, आप उनको 100 करोड़ देना चाह रहे हो. तो हम बोले सर ऐसा है कि आप जब एक स्ट्रक्चर बना दोगे, एक प्लान बना लोगे, एक सही ढंग से प्लान कर लोगे, तो 100 करोड़ क्यों, आप 200 करोड़ दीजिए, हम खर्चा करके दिखाएंगे. What I am trying to tell you all is what the secretary said in the morning, and he was, I wish he was pleading like that to me as he was pleading to CII. आप कुछ करो तो सही, आप कुछ करो तो सही, पैसा तो है. He kept on saying, and this is the story. एक गरीब से गरीब आदमी हमारे देश में टैक्स पेमेंट करता है. वो जब तेल खरीदता है, साबुन खरीदता है, कुछ भी खरीदता है, इनडायरेक्ट टैक्स पे करता है. कोई भी चीज मुफ्त में नहीं मिलता है. उसी के पैसे उसी के पास वापस जाता है, बोलता है वो पॉलिटिशियन वाह ले लेता है कि हम इनको मुफ्त में दिलाए। कोई मुफ्त में नहीं दिलाता है कुछ, कोई चीज मुफ्त में मिलता ही नहीं है, ये भी समझ लीजिए। यू नो कि आप 4 साबुन खरीदो, 2 का पेमेंट करो, आप 4 का पेमेंट किए हो, आपको गोडाउन बना दिया है, वो अपना घर में नहीं रख के आपके घर में रख रहा है। बात समझो कि नहीं? सो आपको ऑलवेज ये सोचना होगा कि हमको यदि आयुष को आगे ले जाना है, सच्चाई के साथ बात करना है, क्रेडिबिलिटी बिल्ड करना है, कोई भी चीज ऐसा नहीं बताना का है कि हम मुफ्त में दे रहे हैं। आप डिजर्व करते हो इसलिए हम आपको दे रहे हैं। आप पैसे दे रहे हो करके, हाँ, आई कुड सी यू आर गेटिंग क्वाइट इम्पेशेंट। सो डॉक्टर साहब, इफ यू डोंट माइंड, लेडी फर्स्ट प्लीज, यू। यस, इनको माइक दीजिए भाई। ओह, आपको नहीं दिखा। यू आर नेक्स्ट, सॉरी।
Hello sir, it's really great attending this session today. इतना कुछ समझ में आ रहा है।
फिर से बोलिए।
It's really great to listen all of you and the initiative the government is taking, and you people are putting in so much hard work for Ayush, and really we are really thankful to all of you.
Introduce yourself.
I'm Vaidya Sonia Karpal. I'm from Faridabad, and I have started at entrepreneurship, my startup in providing Ayurveda super specialty consultations and connecting Ayurveda Panchkarma center so that we can divert patients to the nearest authentic Panchkarma center. It should not be a spa.
Excellent.
It should be an exact Panchkarma center where patient can get the exact
God bless you.
treatment.
God bless you. Fantastic. Very good.
So my question is, like, government is doing too much. They have everything, but the things are not penetrating to the Vaidyas or the people who need that. I have so many people, so many Vaidyas, they don't know what they can do in their career in Ayurveda. All the students are not aware. So if government has access to all the Vaidyas data, like every state has their registration boards, if we can create some system like whatever government is creating, you can just pass on that information through mails, through WhatsApp. They can use that knowledge.
I'll stop you for 2 minutes.
Yeah.
You heard in the morning, Secretary mentioning about the grid. So they are going to invest on the grid, where what you are exactly saying is going to be made available. Am I right?
Thank you.
So you know, your ideas are great. Keep flowing it out. Keep giving it to us. Don't keep it with you. Start talking about it. Send messages to us. We are all working 24/7, and we are sure we will include your good ideas. So don't keep it with you, like what you
Sir,
said.
how to connect? Sir,
Yeah,
how
please,
to connect?
please.
Yeah.
See, Ayush Ministry has got presence in Facebook, X, earlier Twitter, and all these social platforms. And how many of us are the part of that?
Yeah.
And
So,
one
yeah.
more thing, what we lack, we will not respond. We will just see and leave. Can we transfer that to our friends?
Definitely.
If we do that,
Lady.
we have just last week we have assessed what is the impact of our social media platform. It's in thousands.
Yeah.
In this big country, all our Facebook and other social media platforms are getting hits of thousands. That's a great tragedy. So what I suggest, all the fraternity members, stakeholders, should be part of this social media.
आज करेंगे.
Definitely.
Today we will do.
We have to actively.
All of you.
forward
Today
all-
we will do. We will
Then only
do.
this can be achieved.
The mic to the.
Just one more question.
Yeah, mic छोड़ो यार.
Just one more question.
अच्छा
Sir,
पूछ लो.
sir, basically, I just want to know, like, government is creating so much infrastructure. So, how, as an entrepreneur, I can collaborate with government? I can take that benefit, or I can spread it.
गलत कर जाओगे. Don't collaborate ever with government.
Okay.
Just be like an advisor, like he is.
Okay.
Keep advising. Be on your own. You will be successful. Yes, please.
Sir is my mentor.
No.
So Nilanjana Vasu again this side. So conventional system of medicine and this Ayush system of medicine is different. The different lie in one area. That is their, the essence, their philosophy. So by incorporating the standard treatment guidelines, so how will you maintain the integrity of Ayush system of medicines? Like you cannot make a standardization not only in homeopathy, in Ayurveda, Unani, every system has that individualized, personalized aspect. So do you have anything regarding that?
It is true that every systems of medicine have their own epistemological development and they have their own identity. So as far as whatever the standard treatment guidelines, development of SDGs are concerned, actually, what we have adopted so far, actually, for example, these are for the whether it is health and wellness, like Ayushman Arogya Mandir or Ayush hospitals, or even the longer run, we can also it can be a reference document for the entire Ayush sector in the country. So there we have incorporated experts from the, for example, the RML hospital, even Lady Harding Medical College. So they have actually gone through these documents actually, whereas as per our strength, wherever the Ayush has very specific strength, whatever the pathological understanding of the disease conditions, wherever the clinical investigation has to be done, wherever the specific treatment module has to be prepared, that will be very specifically on the basis of Ayush. Whereas in the case of, for example, diagnostic criteria, modern diagnostic criteria we are adopting in Ayush, profusely we are adopting because we want to understand how to explore the disease in the various pathological conditions and at what stage we have to refer the cases so that we have certain limitation at that stage. So for that purpose actually all the relevant modern understanding of the diseases are also incorporated into that. Further integrated healthcare can be developed if there is a integration at the curriculum level. For that also, even the National Medical Commission also incorporated the strength of Ayush into the curriculum. Similarly, you know that National Commission on the System of Medicine, National Commission of Homeopathy also have the curriculum contains the modern aspects also. And even the tertiary healthcare setup, the All India Institute of Medical Science, integrated Ayush departments are coming. So it is very, certainly we can say that these integrated Ayush departments and the aims will be the future torch bearers for the integrated healthcare delivery.
Very good, excellent. Dr. Pradip. Mike.
Okay, sir. This is for three of you in the center, sir. Actually, you are all aware that the Ayush mainstay or its strength is in OP, not in IP. So how do you adopt insurance to OPs in Ayush?
Okay. So can
I will add. Already there are existing policies that are covering OP in our country, and now more and more insurance companies are coming forward to cover OP facility under insurance. But now at present the major criteria is IP only, even now, and all our guidelines. But based on consumer demands, insurance companies are coming up with new and new products covering OP, and one of the major player in insurance sector has come with me and he has discussed about his vision of introducing OP product, and especially for Ayush. And they may be in progress, maybe might have launched or they are going to launch. And other products also they are already in the market.
Okay.
In addition, there is a huge scope for inpatient care in the Ayush actually. If you see whatever the gamut of the non-communicable diseases, what we are managing through, only the thing is that our resources so far we have provided is not to that extent. So when we add this component of the insurance into that, our public health facilities, even the private Ayush hospitals, the large number of patients which really require the treatment facilities like Panchakarma or even Charasutra, or even for the longer stay of the Ayush hospitals, even for the regular monitoring of the patients in the clinical wards. So everything is an opportunity avenue for the Ayush inpatient care. It is not like that our entire gamut of services are only restricted to OPD level consultation. A huge number of disease conditions actually very specifically require the long-term follow-up, long-term treatment regime which has to be adopted through Ayush inpatient care also.
So,
I want to add one thing regarding standard.
Mike, please. Because
regarding standard treatment guidelines, the standards are not a fixed one. means this is what you have to choose for this particular disease. It is a range of treatment, and we have taken care in preparing, setting the standard treatment guidelines for Ayush. All these flexibilities has been provided in the guidelines, and physician can choose according to the requirement of the patient. Tailor-made make is treatment. That opportunity is given.
First of all, my sincere appreciation and congratulations to you particularly because of getting the PPP side of the Ayushman Bharat Wellness Centers that got into the policy through your efforts and your advocacy. I would like to understand, and as you said that still there is not a single PPP model which has come, which has motivated me to be the first one to enter into this area of. But what I have kind of been gone through the document, the latest one, it has to be provided everything free of charge. How do I earn if I'm a startup going into any PPP model? Because I just worked out roughly my per month running cost would be not less than 1 lakh rupee per month. This excludes the infrastructure. So what are the things that you have proposed?
So we will actually, it's a very lengthy discussion. We'll talk offline on this. I'll send you the model, how the model will
In
work.
the session, there was a suggestion to explore CSR fund for this. And if you open a NGO or any facility, so that you can approach with the various companies to invest, and you can establish a facility. It's not that you invest your money,
So
you can invest public money for the public purpose.
They're going to throw you out of this room now. You see, I need to conclude now. So thanks a lot for your participation. It was just wonderful.